to the doctor within probably a month or two of Andy dying. And I don't think I had like a specific reason that I had to go, except that everyone said to me, "You should go see your doctor."
Right. Yeah, you
need to go see the doctor because you're like, I'm a mess, right? I'm not doing
Yeah.
well.
Everyone's worried about you.
Everyone's worried about me. And like, what do we do? Send her to the doctor.
Right.
And maybe she'll just give her a prescription and it'll all be better.
I do think that's people's way of feeling comfort, like the doctor's going to know what to do,
I
right?
know.
Yeah.
And you know what? The
They
doctor doesn't have any clue what to do. Unfortunately.
Yeah.
I wish they did.
Now we're saying this, and if people are watching now or later, just I'd kind of like to know some of their. We don't want to hear just the bad, right? There are bad, and
there are beautiful stories too.
Yeah. Right? Yeah, the good ones of who's gotten it right and how they handled that would be nice to know, because there are some very compassionate.
Oh, yeah.
And I'm not saying that those who don't do it well aren't compassionate.
No,
I go back to what you're saying. They were not taught. It's a hidden in the curriculum for them just to pick up a little bit here and there. It's not direct. There's not clear instruction of what's helpful and what's not.
Well, and we finished our talks, our discussion, and the man that we had doing the video recording, it's interesting because he said to me afterwards, he said a member of his family, I think it was his dad or somebody, had died, and they were wanting to like have a conversation with the doctor about what was happening and feelings and things like that. And the doctor actually said to them, "I'm sorry, I just can't go there. If I would go there with every patient, I wouldn't be able to do it," or something. Right. It was like very curt, very like, and I just totally cut him off. But he felt justified because he's like, if I can't get emotional. I can't get emotional. Yeah. And that is what's kind of taught. Don't get emotional. Don't get too emotionally involved.
Right. And you did a great job bringing that human nature, humanity
and I think that's where you came in too, was like, but how do you take care of yourself?
Right.
When you show your humanity like that, because it is important to show your humanity, but not to the point where now you are really, struggling yourself.
That's a great comment.
Yeah. So someone just wrote in a comment, "I struggle with the doctors wanting to medicate people that are grieving. It isn't always the answer. Depression without loss is different than grief after loss."
Absolutely.
That is 100% true.
And that's what we talked about.
We did talk
knowing
about
the difference, and that the depression that comes with grief is there, but it's different. Like, the viewer mentioned. And it's not necessarily something that has to be treated, because when we treat people or look for a cure, we want to eradicate and get rid of, and we cannot get rid of this, right? So we need care instead of a cure, and that's different.
Yes.